As a neurologist, since the beginning of my training, I quickly came to the realization that, particularly in neurogenetics, which is what I do, we tend to see patients give very sometimes clever, difficult diagnoses, which many times are very deadly, and we don't have many opportunities for these patients. And we let these people go, or sometimes we offer follow-up appointments, but really we don't have very much to offer. So this is what drives me, the possibility of making a change. The disease that I'm interested in that is very close to my heart is called SBMA, or Spinal and Bulbar Muscular Atrophy. This is a neuromuscular condition for which at the moment there is no treatment, so it's a condition with high unmet clinical need. The proposed strategy that we are using is to use an antisense oligonucleotide that would promote the usage of a toxic isoform, which is the one that caused the disease, towards a more benign isoform, or a secondary isoform of the androgen receptor, which is the protein that is mutated in this condition. So these patients develop muscle weakness and muscle atrophy in the upper and lower bodies and in the bulbar region, and they usually become wheelchair bound by 10 to 15 years after the disease onset. This is an adult onset neuromuscular condition, and males only are affected. And interestingly, they also develop signs of androgen insensitivity, such as breast enlargement or testicular atrophy, because the cause of the disease is a mutation in a gene, the androgen receptor, that is fundamental to all these characteristics. And actually, testosterone is key to the pathogenesis of the disease, because the androgen receptor, to be activated, needs testosterone. And the reason why males are fully affected is because they have higher levels than females of testosterone. So the androgen receptor is naturally more active. But in this case specific, the mutation causes a toxicity of the protein. So the androgen receptor becomes toxic to these individuals effectively. What I really like about this program is that the final goal is not necessarily a paper, but rather a product, a medicine that could potentially help these patients. And I really enjoy that shift in mindset. Well, the hope is that at the end of this journey, we will have a new medicine that we could test in patients, and hopefully will make a difference for these individuals. So in a way, this could be really, this journey in a way, if successful, will allow me to go all the way from the conception of an idea to a medicine that could actually help people that I care for in the clinics every day. So it would be absolutely a dream.